How do you protect yourself from a tick bite if you have a dog? I'm addressing this issue as part of a Common Sense Lyme disease series where I discuss questions that come up in my practice and cases I've seen in my practice. Why it matters is dogs carry ticks into your home, but also it takes you outdoors more often. You might be walking, and the children may be playing, and so there's more exposure to ticks when you have a dog, in my experience. And ticks are important because they carry various infections, some of them that can make you quite sick. And even with precautions, you can still get a tick bite. We need to know what's in a tick. The most common infections that we see in a tick in our area are Lyme disease, which is Burley Burgdorferi, but there's also Babesia, which is a parasite. And the parasite is something that can lead to acute illness, but I've seen chronically ill patients from Babesia, although doctors disagree on whether you can have symptomatic Babesia. And it's important because doxycycline doesn't work for Babesia. And then there's other things in a tick like anaplasmosis. Ehrlichia isn't as common. And then there's viruses like Powassan that there's no treatment for, but can be in a tick and can be in a person. So I had a patient who got a tick bite, but he had taken DEET, which he had read from the CDC website that you should do, pyrethrum, which is on his clothes and impregnated his clothes. Still, he had a bite. And he had a dog with a tick collar. Now, I haven't found the various methods very useful at preventing tick bites. DEET's been recommended, which works for mosquitoes, but the CDC recommends it, but I'm not so convinced it helps prevent it. Pyrethrum works if the clothes are impregnated with it, but if the tick touches your skin, then it can still bite you. So you still have to do tick checks. So dogs carry ticks indoors. So even if you're not outdoors, the ticks can move from the dog onto the sofa, onto you. They can be in your bed and move to you. Now, there's several tips that I always advise patients to do the best they can. One is vacuum the furniture, because when ticks are by the furniture, they might flick a tick off, or the tick leaves the dog because the dog has a collar on. No dogs in the bed. Check for ticks daily. Some people take a shower and they can remove the ticks, although the ticks stay attached. The other issue with the shower is you get a chance to do a better tick check sometimes, and that's been helpful. And if you throw the clothes in the dryer, the ticks fall off or die in heat. They don't die in the washing machine unless the temperature is really hot. If you're pregnant, you have to be extra careful because the tick bites can lead to a disease, which can lead to an infection. So for a tick bite, you should always see a doctor, consult a doctor, and work through a strategy. Final thought, dogs are great. Just take extra steps to reduce your risk. And that means is for children also who are around dogs. So thank you for joining me for a Common Sense Lyme disease case series. Have a good day.